Okay, Assalamualaikum warahmatullahi wabarakatuh, and a very good morning to all students who are with us this morning in this Bioethics and Communication course. Welcome to this course. Let me start by introducing to you about myself. Okay, I'm Zahra Sulaiman. I'm a medical lecturer and also a lactation consultant. Okay, in USM here, I'm the head for Women's Health and Development Unit. Right. All right. For topic that I'm going to talk today is about violence against women. Okay, as we all know, this is not something new. We are very familiar about this, about violence against women. However, during this course, bioethics and communication course, we are going to see how, when we communicate with our patients and everyone, how we can actually, use our communication skills to see if we can actually detect, there is some, issues about violence when the patients talk to us. Right. Okay. So in this presentation, I'm going to cover a few topics. Okay. To start with, I will start with the definitions and the consequences or the impact of violence, and then I'm going to talk to you about the violence cycles, and fourth about the statistics, some statistic or data related to violence. And the last one, I'm going to talk about how we can prevent violence if that is possible. Okay, we hope it's possible. Okay, so let us start with the first one. All right. So what is violence? Okay, so if you look at the definitions of violence, okay, there are a few keywords here. I have underlined the keywords. Okay, first it is the intentional use of physical force or power. Okay, so intentional use. Okay, and whether it's threatened or actual. Okay, against oneself, another person, or against a group or community. Okay, that either results in or has a high likelihood of resulting in injury, death, psychological harm, maldevelopment, or deprivation. Okay, so it is intention. Okay, and you are and that perpetrators is using, force, physical force or power, either threatened or actual. Okay, and this will result in resulting either injury or death or psychological harm, maldevelopment, and deprivation. So that is the basic definitions about violence. Now let us look at the definitions of gender-based violence. So what is gender-based violence, or when we talk about violence against women? Okay, it is the acts or behavior or thoughts or cultural practices and policies that ridicules or violate or oppress, deprive, and minimize or deny the existence of a person as dignified human being socially, psychologically, and physically, and this is due to her gender position. Okay, so this is the definitions of gender-based violence. It's different from just violence because it is not related to the gender. And in gender-based violence, it can include domestic violence, sexual violence, emotional and psychological abuse, forced prostitution, trafficking, uh, sexual exploitation, sexual harassment, harmful treatment practice, and discriminatory based on gender. So there are a lot of examples that can be defined under the gender-based violence. Right. Um, I'm going to share with you some facts about violence. Okay, so violence against women, particularly when we talk about intimate partner violence, IPV refers to intimate partner violence. These are actually major public health problems. Okay, and it actually violates the woman's human right. Okay, and we're looking at the data. In general, it shows that about 30% of women have been in relationship report that they have experienced some kind of form of physical or sexual violence by their partners in their lifetimes. Okay, maybe once or twice, maybe more, but on average 30% of women have been experienced this kind of violence. Okay, another point. Globally, as many as 38% of murders, cases of murders of women, committed by intimate partners, and that is another shocking data. It means like 1 in 3 cases, murders they are murdered by their partners, by someone who they know, who they are close to. Okay, so violence can negatively affect women's physical, mental, sexual, and reproductive health, and may increase the risk of acquiring HIV in some settings, especially if it is a forced intercourse and it is not protected, and she is at a higher risk of acquiring HIV when she is having intercourse with someone she is not familiar about the health background. Okay, let's see some of the studies that have relates about violence with first physical injury. Okay, it is reported that about 42% of women who experience intimate partner violence report having some kind of physical injury. That is about 4 in 10, which is high. Okay, and another study have reported that poor general health and greater problem with walking and carrying out daily activities. Because when they have the injury, they have limited movement, and this actually affects their daily activities. 1 to 28% of women being beaten during pregnancy, and this is another sad. More than 90% of them abused by the father of the unborn child. As we know that father should be the protector, but in cases of abuse, more than 90% of the abused father of the unborn child, and being reported that they kick or punch in the abdomen. So it is very sad to see these statistics. Right. Another study showed that sexually assault women had twice the risk of reporting symptoms such as nausea, vomiting, abdominal pain, diarrhea, and bloatedness. This is where I mentioned earlier. In when you see patients, women may not necessarily come to you and tell you that, oh, I was beaten by my husband, or I was beaten by my partner. She may just come to you and tell you, oh, I'm not well, I feel nausea, I have vomiting, and things like that. So good communication skill, good history taking will help you to actually detect whether these women are at risk or are actually the victims of violence. Right. And some of them may come with chronic pain, with back and facial pain, if this thing have been happening to her many times regularly. Okay, what about psychological, mental effect? Okay, again, there are many studies have looked into these issues. Okay, major depression, PTSDs, and other anxiety disorder like psychoactive substance use, self-harm, sleep disorders are being associated with the victims of violence. Okay, another poor general health and greater problems such as memory loss. They come in with problems like, oh, I can't remember what's going on. They did things like they presented with all these presentations. Okay, emotional distress, attempted suicide. This is something that is very, very serious. The effects may last longer even after the violence has ended. Okay, some of them may come with psychological or mental symptoms like sleep and eating disorder, or they can also, as I mentioned earlier, in other studies, panic disorder or depression or suicidal. Okay, next one, let's have a look at some high risk behavior. Okay, these are some of the impact consequences. Like we can see what happened for the victim. They are at a higher risk of unintended pregnancy, okay, because sometimes the intercourse was when they had the intercourse without protection, likely to have induced abortions and STDs, including HIV. Okay, they are also at a higher risk of having sexual abuse. Okay, involved in high risk sexual activity. And we know that high risk sexual activity can increase the risk of unplanned pregnancy among teens. Other high risk behavior, they may also resort into high substance abuse like cigarette, heavy alcohol, using illicit drugs, and without prescriptions. Okay, women with past history of sexual abuse, okay, often engage in consensual sexual activity at earlier age. They have more lifetime sexual partners and more likely to participate in high-risk sexual activities. Right. What about if this thing happened to the woman during pregnancy and postpartum? And many studies have also showed some data that, for example, a prospective study in Hong Kong found that depression in third trimester associated with increased use of epidural anesthesia. They are more likely to uh, take epidural anesthesia into labor, high rates of C-section and instrumental vaginal delivery, and more infants had to be cared in the NICU. Okay, and there are other things like, for example, internet partner violence in pregnancy may increase the miscarriage, stillbirth, preterm delivery, and low birth weight babies. Okay. Another study was done much earlier in 2002, 53 low-income single mothers. They are more likely to have history of childhood abuse and low self-esteem. Okay, and this are related to the victims as well. Um, Another study was really interesting to say that abuse survivor, they have this disturbed cortisol level, okay, and delayed onset of lactogenesis. And we know that this lactogenesis is where the milk is produced, and because of that, they may not produce enough milk for the baby and may actually stop breastfeeding much earlier than other mothers. Okay, so I've completed the first two topics about the definitions, okay, and then about the consequences of violence. That's can be the physical consequences, mental consequences, high risk behavior, and also related to pregnancy and postpartum. I'm going to continue with you, and I'm going to talk about the next one is about the cycle of violence. Okay, so what is cycle of violence? Okay, this is an explanation on what will happen when violence occurs. Okay, usually there will be like 4 phases when the violence occurs. It has the phase 1, okay, which is what they call it tension building. That is the first phase. Okay, second phase, what we call is the violence itself, which is the incident phase. Okay, and this is where the violence takes place. It can be verbal violence, emotional violence, or physical violence, or sexual violence. Okay, it happens after the tension building. All right. What happened after the violence? After the violence happens, this is the phase what we call reconciliation. Okay, so this is the third phase, or another simple words, people call it the honeymoon phase. Okay, this is where the perpetrators will behave like and will apologize for what a mistake that he made and the violence that made. Okay, and the fourth phase is what we call the calm phase. Okay, this is the phase where the victim start to kind of like, okay, forgot or forgive the perpetrators and say, okay, maybe he did it, maybe he was tired, maybe he was having some problem, that's why he was violent to me. Okay, so these cycles will go on and on. To complete a cycle, it varies. Sometimes the violence can occur monthly. For example, it start to occur once a month. Okay, so tension building, maybe it takes longer for the incidents to occur. Maybe it takes about a week for the tension building, and then the incidents occur. When the incidents occur, maybe the damage or that happens to the victims is not so great. Okay, and then the reconciliation. This is where the perpetrators will say, "Oh, I'm sorry. I was not doing it on purpose. I was really, I was really in a bad mood," something like that. And at this time, the fourth phase, the victim will say, "Okay, I forgive you. I know you didn't mean to hurt me," something like that. And they get back together and everything's like goes well, like nothing happened. And again, the tension building something will happen, and that will contribute to tension building. And then later on, the incident will occur again. Maybe initially, this cycle will take about maybe a month to complete, So maybe the violence occur just monthly, okay? And usually, the cycle will become shorter and shorter. It means that instead of once a month, maybe after this it become more frequent, once in every 2 weeks. The tension buildings comes back, incident occur, reconciliation, and calm. And if nothing happened, if the woman doesn't get help, and if the man is not, didn't get charged, and this cycle didn't stop, the cycle can go like maybe once a week. The tension building will come again, and usually when it's become more and more chronic, it just need a simple things, to spark the tension. For example, the wife is late to open the door, or the wife cooks something to the husband is not nice to him. That sometimes as simple as that enough to make the tension building. However, the incident as time goes by can become more and more severe. Maybe initially the violence was just like slapping just once, and later on it become more violence. He used maybe brooms, or some things that will cause more severe injury, like fracture, things like that. And later on, the reconciliation become lesser and lesser apologetic to what had happened, and to a point, this tension building cycles is so fast, like it can occur even daily. Like the violence can happen even daily, and this is very, very bad. So why I'm going to talk to you the next one. So some in early part, usually the victim may not realize that it is a cycle, because they have the reconciliation phase. So when they have that reconciliation phase, usually the victim will say, oh, okay, so it was not on purpose, because during the reconciliation phase, the perpetrator will usually apologize, will try to give excuse, and what happened was something out of control, it was not my intention, things like that. Okay, so this was one of the reason, I would say, why usually the victims stay in a abusive relationship, for quite long time. Okay, if you talk to the victims, some victims can stay in a relationship for more than 10 years, sometimes 20 years. Okay, so let's have a look. Sorry, this slide is in Malay, the only slide I have in Malay, but I will translate to you in English. Okay, so this is one of the posters by the Women Ministry. So these are the answers given by the victim. Why do you remain in a violent relationship? Even though you get hurt, you are physically bruises, things like that. But why do you keep maintain this relationship? Okay, there were a few things, but here I will talk to you first. Malu means that they don't want their family, to feel look back by other people, like, okay, oh, she comes from a very good family, so you shouldn't do this, so it's not a good reputation for your family. Okay, that's one thing. Takut means that she's afraid, if she's going to report this, it's becoming worse, because, for example, if the perpetrator knows that she report the case, she may got worsen bitten, the violence may become more severe. Okay, the third one, because of the kids, some of the victims feels that if they report, maybe they will not be able to see their kids again. They don't have, they lost their rights to see their kids again. Love. Some of the other reasons why the victim maintain the relationship because she may still have love or feeling towards the perpetrators. And another one which is important as well is because most of these women they depends financially towards the perpetrators. Okay, so economic status. Because she's not working, and she needs, financial support to survive her daily. So because of this, some of these reasons, women maintain or stay in a toxic relationship, even though she get abused. All right. Okay. So these are that was actually from we got it from the Jabatan Pembangunan Wanita, which is Women Department, Ministry of Women. But other things, when we talk to the victims, when we ask them, and when we see around, okay, some other things why the violence continues, okay, because of lack of respect towards the woman, okay. They have less respect towards the women or children who are less powered. And this is sad because we expect people who are more physically powered or can actually protect the woman, can actually protect the children. Okay, not paying attention to critical values such as justice, integrity, and equality. Okay, lack of attention or prevention mechanism. Okay, we usually see, especially when doctors see patients in casualties. It already happened, okay? So the damage is already there. So what we want to do is actually how we can actually focus on the prevention mechanism. Lack of enforcement of structure that exists, such as law, service. There are laws, but sometimes women feel that it is too much work or too much effort for them to go to the court and other things, okay? And politicals and communal will to change, and lack of political and communal. So because of this, some bureaucracy, women feel that, okay, first I have to make the report, then I have to talk again to doctors, then I have to talk again to the police. There are so many, procedures, and this thing are not helpful for her. She may still have the emotional stress, and now she has to go through another stress in making reports. Things like that is not very helpful, for victim. Right. I'm just going to share you in this next slide a few data from Malaysia. Okay. And this data are actually driven from a few studies that were conducted in Malaysia a few years ago. Okay. The first one, talking about the prevalence of intimate partner violence in Peninsular Malaysia, they found that 9% of the prevalence. Okay. Another study which was conducted much earlier found that this indirect prevalence was actually much higher, about 39%, and that prevalence is actually more at par if we compare to the global data that I showed you much earlier in my slide. Okay. Another finding shows that emotional violence is the highest form of violence. Okay, but that is one of those which is very difficult to find evidence. Okay, because emotional violence, you may not have like photograph, you may not have written documents. It is a feeling that the victim have to tell that, okay, this is what happened to me. Right, sexual violence is the most difficult form of intimate partner violence to report. Okay, to report that one, some people say, like, oh, can I report this? They feel ashamed to report this. Some of them feel that it's not easy to report. As I said, here is the most difficult form of violence to report. Okay. Another important point, when the violence occurs in a family, even it occurs between the father and mother, however, the children are badly affected. I'm going to show with you some data after this. Okay, the children are badly affected with what happened to their parents. who live together with them in the same house. And local data and some study also showed that from this same study, EBIT, okay, woman suffers physical, mental, and during pregnancy, and this is also was the findings from study overseas. If you remember just now, I showed you some of the data, said that most of the perpetrators are the father of the unborn babies, which is sad, okay? And it is worrying that when the violence is really, really bad, death is one of the worrying outcome, and that can happen. Right. Okay, I continue with the presentation. Okay, so these are some of the emotional distress. This data came from a study that were conducted in Malaysia. You know, they can come to you in the clinic. You know, just presenting with like feeling unhappy, or I feel nervous, I feel tense. You know, if the doctor is good in taking history, in communication, this will give some hint into finding more underlying cause of that. Okay, so as I said, women will come to the clinic most of the time, will not tell just the doctor, I was abused. It takes guts, it takes really courage for them to tell. Most of the time they come with emotional distress, such as I don't feel happy, I'm nervous, I'm tired, I'm having headache, I'm sleeping badly, things like that. Okay, so it's very important to have some other cues, questions, so that we can actually detect that this woman needs further help. Not just headache, not just tired, normal tired. Right. When we look at the victim's occupation, right? Look at this data. You can see that the highest, that is percentage, okay, 40%, 30, 20%, and 10%, okay? Nearly 40% of the victims are housewife, okay? And if you remember just now, when I showed you why the women remain in that toxic or violent relationship, is because they are dependent on the perpetrators for the financial support, okay? And when we look at this one, we can see that the highest occupational status is housewife there. Not to say that other occupation are not at risk. They are still at risk, okay? Managers, professionals are also at risk. Shop assistant, clerical, business, even people who own business, even though some women who are not financially dependent on their spouse, on the perpetrators, but these things can still happen. Why? If you remember, I mentioned just now, one of it is, from our observation, when there is lack of respect. When there is lack of respect, violence can happen, regardless if the woman dependent or not dependent financially to the perpetrators. Okay, what about if you look at the cases by marital status? Okay, most of them are married. Most of them are married in a married relationship, and that's why when I showed just now, you can see that pregnancy is one of the risks. Women who are pregnant are at a higher risk of being abused, and 90% of that is done by the father of the unborn, which is sad. Okay, and there are a few smaller percentage of unmarried, separated, in process of divorce or divorce relationship. So these were the more married status were the most common status of the victim. Right, I mentioned just now to you about the impact on children when the violence occur at home, when the violence occur in front of the children. Okay, this will have some impact to the children, and it will depend on the age. Look first at the slides on the left with the green bar. Okay, if you can look at the green bar, the first one is the children witness the violence. Never, very little children in a violent family don't witness the violence because they are there. And you look at the last one, many times, 50%, half of the children actually observe the violence again and again. If you remember the cycle that I showed you earlier, okay, the violence can occur maybe earlier monthly, and then every 2 weeks, and then weekly, or maybe daily if that's really bad. Okay, so the children will witness the violence maybe once or twice, very small percentage. Several times more children witness that. Many times, 50% of the children in the family of violence witness it many times. And what will happen to them? Okay, sorry about the slide. There's some, but you can see that. Okay, I just read that one. Impact of the children, especially aged between 5 to 12. Okay, first, nightmares. They may have nightmares suddenly, middle of the night. They woke up and say, "Oh, what happened?" And they had this palpitations, things like that, or maybe sweating, or they get nightmares. Okay, suck thumb. Yes, this is not a normal behavior for a grown up. After like primary kids, like, but they do that as a comfort behavior. Okay, wet the bed, kencing malam. Okay. Especially when they are already off their pampers, we don't expect that, When they are potty trained, they are toilet trained, yes. But when they go to school, this is not a normal behavior. So when they wet the bed, this is a hint to tell us that these kids may have this impact of stressful, where they witness the violence. Okay, timid, they may be shy, they don't talk much. They may not question much, they may be quiet, okay? But at the same time, on the other side, some children may become aggressive, okay? They become aggressive because they see aggressive is the way of communication. They see that aggressive is the way to tell whatever feelings that you have. So they can, behave in an aggressive ways. Okay, we have talked much about, I think, 4 topics that I want to cover today. The definitions, okay, the impact of consequences, and then we talk about just now the statistics, okay, and what about the impact on children, right? So I'm going to continue with the last part. I would say this is one of the important part. How can we prevent this? Okay, how can we prevent this violence? If you look at the cycle that I showed much earlier, okay, let me just go back to the cycle. Okay, right. Okay, if only we can break the cycle, then we can break the violence. Okay, so but to break the cycle, the woman needs help. The woman needs courage. The women need to have support. For example, if the woman feel that the violence may threaten her not being able to see her children, she need to be supported. She need to get information that, well, she still has the chance to see her children even after the separation. If the woman feel that if she wants to break this cycle of violence and she has to leave the relationship, she may not have financial support to support herself. So she needs support financially. She needs support where she can be employed, or she can start a small business where she can be financially independent of the perpetrators. So in order for us to talk about prevention, we need to actually look at what are the causes of the issues, right? And that will help us to customize or individualize, okay, what will be helpful to a woman and what will be helpful to another woman. All right, I'm going to share with you this kit or this framework that were produced by WHO, what is called Respect Women, okay? And this like a recipes, okay, respect women. How if we can do this respect women, we can help to actually prevent violence against women. Okay, let's have a look at what respect is all about. Right. So in respect, there are 7 strategies to prevent violence against women. Okay, I'll just read first what it means here. Respect. R is relationship skills strengthen. Okay. Second one, E, empowerment of women. Empower her in terms of decision making. Empower her in terms of her rights. To be treated well as a woman. Empower her in terms of financially as well. As services ensured. Yeah, this is again when woman wants to get helped when she goes to the hospitals or when she goes to the police stations to make report. So it's ensured services for her. Okay. P, poverty reduced, which is related to financial independent. E, environment made safe. So this is another important thing. She need to be ensured that she can leave the place safely, and she will be help to start a new life in a safe environment. Right. C, child and adolescents abuse prevented. As I showed before, you can see that many of the children, more than 50% of them actually witness the violence many times again and again. So, and this can actually be the risk that they, when they grow up, they can either be the victims or they can be the perpetrators because they witness the violence. Okay, and T, transform attitudes, belief, and norms. Right. I will show you this one, but I'm not going to go through the detail with you. You can go to the WHO website and you can actually browse respect, and you will get this. They have this very nice in PDF format. Okay, and you can have a look at these details explanation. Relationship skills strengthen. Okay, how to do that? When we talk about relationship skills strengthen, we are not talking just about the woman, but about the partner, about the husband as well. Both of them need to have counseling and therapy, couple counseling and therapy. Okay, empower, training of women and girls, including life skills, safe space, and mentoring. Okay, service ensured, empowerment counseling intervention, have shelter, temporary place where they can actually feel safe as well. Poverty reduced, I mentioned earlier, economic transfer, cash or some voucher where they can actually use to survive. Okay. Environment made safe, infrastructure, transport, of where the kids need to go back to schools. It is safe for the kids to go back to school and protected. Child and adolescent abuse prevention, okay, parenting intervention, life skills, school-based curriculum, okay, how they can actually, we can prevent this from they become abuser. And lastly is the training attitude, belief, RESPECT, training attitude, belief, and norms. Okay, group-based workshops with women and men to promote changes in attitudes and norms. So if you look into all these points, respect, it doesn't involve just the woman. It also involves the partner. It involves the children. It involves the community. It involves the services, and it involves the environment. Okay, so if you look into how we can prevent this from the ecological approach, okay, let's go through this circular diagram. The individual or the victims is the one in the middle. Okay, we need to help the relationship. That was one of the relationship skills strengthened, right? But that's not enough. Okay, look at the second circle outside the relationship is the community organization. We also need to help the community or the organization have the services, have the facilities that can actually help the woman and the victims as well. All right. And if you look into the outer circle, which is the society, okay, the society need to actually change the norm, or how we treat the less powered people, should respect them, and we should help each other instead of uh, uh, being mean to them and become perpetrators, and violence happen to them. So uh, as a nutshell, in terms of how we can prevent this, it needs involvement from the whole community. Not just the woman need to change herself, not just the relationship, the community, the services, and also the environment, right? Okay, so let's say after you leave this lecture, okay, um, we may think what we can do. Okay, we can help to actually spread the importance of treating other people equally. We can help and spread that, okay, this violence is not acceptable. It is against the rights. It's against the rights of the woman, and we have to protect them. We have to talk. We have to protect the children as well. Okay, so. And these are some of the role of the society, what we should do. Okay, mobilize society institution. Okay, strengthen. We have to support, sustain family institution, and this needs the whole family to understand, not just the woman. Okay, promote, encourage, safeguard, caring environment, and in terms of volunteerism work. This all can actually inculcate a good behavior and environment. Look back into the laws and the systems, how we can make the report more easy for the woman, less stressful for them when they go to the hospitals, when they go to the police station, they can get supported as well. Okay, what happened? Okay, this is one thing. I'm sure you are familiar with OSCC, One Stop Crisis Center. We also have this One Stop Crisis Center in USM. We also have this One-Stop Crisis Center in Hospital Raja Perempuan, HRPZ. Okay, so this is actually in place, which is very good. Whereby when the victim go to the hospital, they can go to this OSCC One-Stop Crisis Center, and they can be referred to this place by either by herself, or by police, or JKM, or NGO, or relative, or hospital himself. Okay, and when they go here, there will be a team of OSCC team will actually assess her, and will see what are the needs. If it's really critical, she had a very severe fracture, or wounds and things like that, and need to be treated, that's we go first to the red zone. Or is it semi-critical, or is it non-critical? If it's not non-critical, then she will be managed in the OSCC room. Okay, and this is where they will have the second triage. Will be examined by the emergency doctors and specialists, and this is where they will ask questions, and they will try to find evidence and looking at that. Okay, under the OSCC, if you look at here, right, the OSCC room. Okay, they will refer to relevant department. Also, they will refer to the medical social worker. Okay, and this is where many institutions play role. Some women find it's very difficult when they have to actually explain to the police, explain to the GKM, explain to legal or referral, explain to other NGOs. So if this can be made easy for them, it'd be easier for them to actually make a report on how this OSCC can be helpful. How can we make it better? Of course, in any services, if you look at this diagram, it's a very busy diagram, right? But these are all the steps that needed so that the woman can be examined properly. Okay, but of course it takes a very long process looking at this. Okay, so there are things that how we can help to actually improve or scaling up OSCC. Definitely, OSCC is run by staff, and we know that sometimes certain places they have high turnover of staff, and therefore it's very important for the staff get sufficient training. Okay, and in the training they also need to be taught on what are the protocols for the in taking evidence, in asking sensitive questions. Okay, and these are all important to improve the service for the OSCC. Okay, and in OSCC, as I mentioned just now, there are many stakeholders that involved in this OSCC. Therefore, strong referrals between hospitals, between unit, and agencies are important so they can coordinate. Okay, we know that in some hospitals they have like a police center, like where the woman can make the police report at the same time when they make the hospital report, so they don't have to go to many places. So this referral and coordinations is very important so that the management of the case can be much easier for the woman. Okay, and it's important also to define the roles among various health and non-health actors involved. Okay, so who should actually take the samples or takes the evidence? Is it the doctors? Is it the police? Is it the nurses? Who are supposed to look after the children? Is it the JKM, Kebajikan Masyarakat, who are supposed to have to make sure that these women have a temporary shelter? So all these things are important to ensure that the women can be helped in a good manner, and they will. And when this happens, everyone takes place together. It will reduce the stress that the woman has to go through. Okay, so I think I have completed my talk today for these topics on violence. If I can just go through again, violence against women, as I said, this is not uncommon. Sometimes we can see these topics in newspapers, in news, on the TV, on radios. So what is the things that we are talking today is that in this ethics and communication, we hope that at least we are aware when we see women come with other symptoms, and we are aware that perhaps we need to ask further if there are some clues to see that whether these victims needs further help. No, not just headache, because they tend to come with headaches or pain. They come with nausea. They feel unwell. They feel stressed. Okay, but we need to know further so that by knowing that, by having very good communication skills, we can help them further and prevent this from happening. Okay, so how can we prevent this? I have talked to you, and we as part of the community, we play an important role. Okay, we may think that I'm not in the scenario, but if you go back to what I showed you before, okay, this is the cycle, right? Okay, the ecological. So we are part of the community. We are part of the organization. We are in hospitals. We may see them in our when we are in the emergency, or maybe we are the one in the psychiatric, or we are the one who give the counseling. So we are involved, and we can play a role in helping to prevent this thing from actually occurring, and we can stop this bad behavior. All right, so I think I have finished everything, and I hope you can learn something from this topic. And if you have anything, you can always contact me. That's my email there. So that is a small z, not capital Z, zahara@usm.my. Okay, thank you very much. Assalamualaikum warahmatullahi wabarakatuh.